Squish. Hello, Mr. Fung. My name is Ryan. I'm a nursing student today. I'll be conducting a head, ears, eyes, nose, mouth, neck, and throat assessment on you today. Is that okay?
Sounds good.
Great. Before we start, can I see your wrist? Can you have your name, date of birth?
Zachary Filling, January 8, 2001.
Great. And then do you have any allergies I should know of before we start?
None.
Alright. So like I said, I'll be doing a head, ears, eyes, mouth, nose, neck, and throat assessment on you today. It'll require me to examine those or inspect those areas of interest as well as palpate those areas. Are you okay with me doing that?
Sounds good.
Great. And at any point you feel any pain, distress, or discomfort throughout this whole process, please let me know. We'll stop, let you gather yourself, and continue on when you're ready. Okay?
Okay.
Great. So we'll get started. So just doing a general assessment on my patient. Patient has an upright body posture. He does not look like he's any distress, discomfort, or pain. He has even hair distribution. His eyes are symmetrical and no nasal drainage. And he has an overall calm demeanor about himself. Okay? So, Mr. Fung, the next thing I'm going to do is I'm going to ask you some questions that are meant to help guide my assessment. These should be basic questions for you, so just answer them to your best ability, okay?
Okay.
Great. So, first of all, have you noticed any problems with your head, ears, eyes, mouth, nose, or throat?
No.
Okay. Have you had any recent injuries to your eyes, ears, mouth, nose, or throat?
No.
Okay. Have you had any surgeries to those areas of interest?
No.
Do you have any chronic conditions to those areas, like any eye problems, ear problems, or anything like that?
No.
None? Okay. And do you have routine or at least yearly examinations for those areas of interest, like a dental exam or a vision exam?
Yes.
Okay. Were there any abnormalities or concerns that for your physician last time you were at your those exams?
No.
Okay, great. So those are all my questions, okay?
Mm-hmm.
Now we're just going to go on to the actual assessment, okay? So first thing I'm going to do is I'm just going to do a quick inspection of your head real quick. Okay, great. All right, so patient's head is round, normal cephalic, symmetrical with even hair distribution. His eyes or his nose is midline, and his face is symmetrical with no abnormal movements or tics. Okay, I'm gonna go palpate real quick. Is that okay?
Okay.
Right. Do you have any pain?
No.
Over here?
No.
Nope. Here?
No.
Okay, great. Let me go check your nose real quick too. Any pain?
Nope.
How about when I go down the middle?
Nope.
All right. How about over your sinuses over here?
No.
Here?
Nope.
Okay. No, nowhere?
No.
All right. Patient has no signs of pain or tenderness upon palpation of his head, nose, or sinuses. No swelling in those areas as well. Can you do a quick job for me? Cover one of your nostrils and take a deep breath in and out. And then do it again as well. All right. Patient's NURS are patent bilaterally with no nasal drainage as well. Patient has no signs of edema or erythema over his sinuses either. Okay. The next thing we're going to do, Mr. Fung, is I'm going to go take a quick look at your ears, okay?
Yep.
Is it okay? Pull your ear back?
Yep.
All right. And then I'm going to do it to this side. And then, okay. Great. And then I'm going to palpate real quick. Is that okay?
Yeah.
Any pain?
Nope.
Okay. This is your external ear, and then your tragus is right here. Do you have any pain here?
Nope.
Nope. Okay. So patient's ears are symmetrical, have appropriate color, no signs of erythema or edema, no drainage or leakage from his auditory canal, and has no signs of pain or tenderness upon palpation of both his external ear and his tragus. Okay? The next thing I'm going to do is I'm going to look at your eyes real quick. Okay. Patient's conjunctiva are clear, no drainage or erythema, and his sclera are white with no signs of icterus, and his eyes are symmetrical as well. Okay? Mr. Fung, the next thing I'm going to do is I'm going to use this pen light, and I'm going to be looking at your pupils, okay?
Okay.
Just to give you a heads up, when I do use this, I'm going to be shining the light in one eye, and I'll be quickly observing the other eye to see how it reacts as well, okay? So don't be alarmed if I'm switching between both eyes, okay?
Okay.
All right, so let's get started. Okay. And then the other eye. Okay, great. Next thing I'm going to have you do is, can you look at this wall?
Mm-hmm.
And then focus on my finger now. Okay, I'm going to try it again. Give you a little break.
Mm-hmm.
Focus on that wall. And focus on my finger. Okay, great. All right, patient's eye pupils were 3 to 4 millimeters and symmetrical. Overall, his pupils are equal, round, reactive to both light and accommodation. and both pupils have direct and consensual reflex, which means direct is when I shine the light on the pupil, it constricts, and the consensual is the eye that doesn't have the light constricts as well, and that was seen for both eyes. Okay, great. Next thing I'm going to do, Mr. Foog, is I'm going to go inspect your mouth. So can you open your mouth real quick? All right. Can you say ah?
Ah.
Say ah again.
Ah.
Okay. And I'm going to look at your teeth real quick. It's going to take a little longer. Okay. And can you kind of put your tongue down so I can see the back? Okay. And then can you stick your tongue out? And then can you lift your tongue up? Great. Okay. Patient's mouth and teeth are intact. His oral mucosa are moist and pink with no lesions or open sores. His teeth, he has no missing teeth, no presence of dental caries, gingivitis, or halitosis. His tongue is pink and moist as well with no abnormalities, and his tonsils appear 1+ non-injected. Okay. So the last thing I'm gonna do for you, Mr. Fung, is I'm gonna go. We're gonna inspect your neck, okay?
Yeah.
So I'm just gonna do a quick look around your neck, real quick. I agree. I'm gonna check the back. Great. Okay. Patient's neck has no gross abnormalities present. His neck and larynx appear midline. Okay. The last thing I'm gonna do is I'm gonna go palpate your neck. Is that okay?
Yeah.
Just to give you a heads up, my hands are around your neck. Any pain in the back? How when I move forward?
No.
Get closer to the middle?
No.
Okay. No pain or tenderness?
None.
Okay, now I'm going to go look at your lymph, or feel for your lymph nodes, okay?
Yeah.
This is your preocular.
Okay.
Postocular.
Okay.
Okay. Occipital.
Got it.
Okay. Submental.
Okay.
Submandibular.
Okay.
Okay. This is your anterior chain.
Mm-hmm.
Okay. Posterior chain.
Okay.
Okay. And I'm going to go look for your supraclavicular, which is I'm going to go pull down your shirt. Is that okay?
Right.
Great. Okay. Great. So no pain or tenderness?
None.
Right. Patient has no signs of pain or tenderness upon palpation of his neck. He has no discernible lymph nodes present, and he has no goiter present. Okay? So, Mr. Fung, that is all I have to do for you today. Do you have any questions before I head on out?
No.
Okay, you have a great rest of the day then, okay?
Thank you.
Squish.